I think as retina specialists, we are unique in the healthcare sphere, the ecosystem, in that the volume of patients that we see it ranges somewhere from twice to triple to quadruple the volume of a typical outpatient medical practice. And so for us to keep rooms sanitized, for us to maintain social distancing, to perform all the testing we need to do, and have patients happy with us throughout all the processes that need to happen to maintain safety. It's been a really, really difficult but important pivot that we've made. And so we have to be vigilant that COVID-19 may be a COVID 20X in the future, 2025. I think letting our guard down and saying, we can go back to the ways of old probably isn't wise. And honestly, there are many, many things from a standpoint of sanitization that I think we can't really go back to. I don't think patients are going to tolerate rooms not being wiped down thoroughly before they come into a room. They're not necessarily going to tolerate doctors not wearing gloves or certain people not wearing masks. It's going to be interesting to see how that plays out. So we've really maintained a lot of protocol that we initiated because of the pandemic, and I think much of it will continue beyond it, not only to maintain the safety level that we have, but to be prepared for the future. So it's a really difficult thing to see 80 patients in a day and keep people distanced, but we figured it out. We've rearranged the way that we image patients and the workflow and the dilation protocols. There's all kinds of things that we've tinkered with to maintain safety, provide a high level of care and quality and meaningful time with the doctor all at the same time. So those are the things that I think are the legacy of the pandemic, and honestly, some of them are really good. I'm grateful for some of the changes that have happened. When I inject a patient, I used to never wear a mask, and there is good data out there that if you don't speak immediately before an injection, or you wear a mask before an injection, your risk of contaminating the field and causing an endophthalmitis or an infection of the eye as a result of the injection significantly drops. I used to never wear a mask, and I used to have difficulty kind of having the patient not talk, having myself not talk. It was you want to have a conversation with the patient and maintain that personal connection, even perhaps while you're performing a treatment. But now, I can wear a mask and feel safe that I can chat with them or give them instructions without giving them nonverbal cues or sort of taking away from a little bit of the humanity that we have in communicating with them. So there's some good and bad that's come from the pandemic, and I think much of it has been good.